Welcome to the awareness series by the Reach Clinic. We are a center for child, adolescent, and women's mental health. My name is Rachel Jaiseelan, and I'm a consultant psychologist, educator, and NLP practitioner, also consulting at the clinic. I work in the domain of assessments and psychological testing. I'm joined today by our consultant psychologist, Ishita Datta ma'am, and she is a practicing hypnotherapist, and she has working experience of more than 26 years in a variety of establishments, NGOs, educational institutions, and corporates. um, and she consults with the Reach Clinic, the only group, and catering to the needs of students as well as adults. She's certified in transactional analysis and enjoys music, painting, and she believes strongly in the power of love. Ma'am, it's lovely to have you with us today. We are here,
Thank you.
both of us, to discuss about a significant concern that Reach Clinic caters to, and that is pregnancy, which is one of the experiences that is both exciting, challenging, but it can also be very overwhelming. Women might experience a range of emotions right from the time of planning the pregnancy to during the pregnancy, and even after delivery. So
Yes.
external factors like family stress, work related pressures, household routines, even the dynamics that they share with the partner can have an influence on the mental health. So in this segment we will be discussing pregnancy, mental health,
Right.
in addition to certain self care tips, right? And ma'am,
Right.
so we could begin with talking about what are the stressors, what are the possible stressors that a woman can experience during the prenatal, the period in which they're planning the pregnancy, and how can that affect mental health?
See, compared to the past years, past decades, and our previous generation, the time has changed a lot. Now the woman is, trying to fit in many chores, many roles.
Mhm.
So, planning a baby, which is a huge responsibility, uh, it comes with a very big, uh, thought that it might create a huge burden. Okay, the financial thing, the commitment from the partner,
Mhm.
the readiness of mind, all those things can cause very big stresses. And preconception is a very, very important, I would say, the most important phase, when a couple is planning for pregnancy, because it's just like, you when you are going to plant a seed,
Mhm.
in a garden, you prepare the soil, right? You give manure, you give, bring it to the right condition. A woman's physical situation and her mental situation is very, very important, because the readiness of going forward, physically and emotionally, is both are very, very important here. So the challenges are a lot nowadays, especially in the modern age, because we do not expect women anymore. They are constantly restricted to the household chores, and even if they're a homemaker, if they have planned to be a homemaker, still the life is very, very challenging, because the husband might be extremely busy. Okay, and nuclear family, many, many aspects. So very important that a lot of talk has to happen between the husband and wife or partners, and a thorough medical checkup for any genetic history, physical condition, like chance of blood sugar, the tendency of blood pressure, overweight, lot of things are there, possible anemia, all those things in the physical domain. Emotional domain, that how committed the couple are, because once it starts, the preconception goes very well planned, it's like the foundation,
Mhm.
then the pregnancy is likely to be more smooth.
Smooth. So, ma'am, what are some of the steps that a couple can take to ensure positive mental health?
Lot of talk between them and about parenting. Unfortunately, in the parenting classes are not that rampant or not that much available. There are certain places where people can go and learn parenting, but main thing is what is the role, how from a very carefree lifestyle and individualistic lifestyle, how suddenly both will be connected with another human being.
Okay.
So this talk and the expectations should be set. Okay. And otherwise it is seen that especially it happens with the woman involved, the mother involved, that many times what she has expected, the fairy tale kind of thought process of pregnancy, that gets sometimes very much harmed and disturbed if the partner is not reciprocating. So they have to understand that there is lot of talk about commitments and expectations, and if they want to see some counselors to or the adults in the family to understand what is the role, the main importance should be given to the role of parenthood. And then I think as I have said, that it's very much required to go for physical checkup and to understand the body is ready.
Okay.
Those things are important.
So to set realistic expectations also in terms
Yes,
of
absolutely,
that
absolutely, absolutely.
Ma'am, what about during the period of pregnancy? What is considered stress that can influence mental health in terms of both, say, the mother, as well as how can it influence the subconscious of the child?
Pregnancy, some of the stresses are unavoidable. The body physical stress, the discomfort, sometimes the woman the mother gets very disturbed by the changing looks, as the pregnancy advanced. And as I have said, some of our fairy tale beliefs, those are very normal situations. The stress can come up and can go. When the stress comes up and goes, it doesn't create that much impact. But if it is chronic, then the release of this very high level of stress hormones, the studies say that they pass through the amniotic fluid to the baby, and there is a huge correlation of stress during pregnancy and ADHD. There have been studies, hyperactivity, attention deficit.
Okay.
Also, if the stress is very, very strong, very severe, then in many cases, there is 80% more risk of stillborn baby. Yeah. And there are some neurological, because the stress hormones affect the central nervous system of the fetus if it is for a very longer period. Little bit of stress here and there is very normal, but it can alter the structure. Yes.
Is there any way to find out that the developing fetus is being affected at that stage itself?
Yes. You can, by the heartbeat, sometimes it's a tachycardia, bradycardia, the higher level of heartbeat, sometimes is a lower than average, that the normal heartbeat, loss of weight,
Okay.
Those things, premature birth. There are quite a few. Stress is as we, in the normal lifestyle, stress is the biggest problem, for emotional health and as well as the physical.
Ma'am, what could be some of the examples you could give, even from your experience working with this population, as to emotional stressors during the period of pregnancy?
Oh, emotional stresses could be, sudden burden of finance. But I have seen it is more to do with the emotional situation when there is less of a, bonding between the couple, pressure from the household chores. If the mother has one more, child who's young, the previous, it's a second pregnancy. So the stress can be enormous, and mothers often, get into depression. And it has been seen that if during pregnancy the mood is low for a very long time for the mother, the
Okay.
chance of postpartum is even more.
Okay.
So from my experience, I have seen it's whoever the pregnant women or mothers who have a birth immediate came with a newborn, they have talked about the pressure and sometimes feeling unloved, uncared for.
Okay.
You cannot blame the partner all the time, but it's the emotional need is very high at that time.
Understand.
So those, I mean, quite a few practical reasons and quite a few emotional reasons, but the net effect is same. Yeah.
What are some of the other reasons for postpartum depression?
There could be other than the pregnancy related things, there could be a predisposition. There could be the already a predisposition of a low mood in the mother, genetically inherited because of some gene. We know the some studies have proved some correlations. There could be a thought process that the prone to negative thinking. Negative means that I am lacking something, that it may not be connected to any apparently very big reason, but a little bit of change in the environment or interaction can bring this thing in. So there is if there is a predisposition in the woman, then the chance of low mood and postpartum is lot.
And in what way can postnatal maternal mental health affect the child?
Oh, that's I think the first 2 years, the infant is like a sponge because they don't listen to you, they watch you. The mother's low mood, anxiety, all create huge impact in the subconscious because the baby has no experience in this world. Okay, the caregiver, the immediate primary caregiver is the mother. So the mood affects like a direct bullet.
Okay.
So anxiety, crankiness, everything, loss of appetite, clinging to the mother, all those things happens when the mother's mental state is not in the right place.
Okay.
You know.
And what
Yeah.
can caretakers do, ma'am, during the 3 phases that we spoke about? In the process of planning the pregnancy, during the pregnancy, and even after delivery, what can caretakers do to ensure the mental health of both the mother as well as the child?
See, the who is the caretaker? That's in the West, it's mainly the partner, husband or the partner. In India, it can be the the maternal, the mother's mother. Okay, sometimes it's a joint family, so the caretakers are fortunately sometimes distributed. The burden may not be on the husband only, but whoever is the caretaker, it's very important to give a strong emotional support system to the mother.
Okay.
It's overwhelming because your body is changing, your homeostasis is changing. You are bombarded by hormones, you are bombarded by the sudden heat and lot of changes. So the caregivers have to be continuously providing emotional support. The basic thing is the emotional support. Physical thing can be taken care of by the doctor. Okay, by observing exercises and good food and all, but the more important thing is the emotional. If it is a happy pregnancy, it has been seen that if it is very happy pregnancy, then the children are happy.
Okay.
When the oxytocin, dopamine, all those happy things are, chemicals are high in the blood. In the 24th week, the fetus develops the the ability to listen from outside. 24 weeks in the womb. Therefore, any bit of higher noise, like shouting at the mother, okay, or any quarrel, conflicts, the child feels it. It's very important the immediate caregivers start talking soothingly to the mother, soothingly to the child in the tummy. And it's very important, the whole environment. The caregiver's first job is to be very, very, vigilant. And in case, even with all these things, if the persistent low mood, crying spells, that go for a long time, then they have to contact a professional.
Ma'am,
It's
what
better
would
to
be
contact a
the
professional.
other indicators? What would be the other indicators to for when should a woman during these three phases seek help? What are the indicators?
When you see there is the low mood is persisting for a very long time, sleeplessness, the mother, the pregnant mother is not eating, okay, not sleeping, anxious, crying, losing cool, patience too often, okay, develop a kind of apathy towards the pregnancy, losing interest in taking care of herself. All these are very serious indications. Okay, it can, see, preconception is still, if the woman doesn't want it, okay, she has the choice. Okay, when I said there should be a good preparation, and while talking, and before conception, the mother has a choice, okay, not to go ahead with the pregnancy because it hasn't happened yet. But once the pregnancy has happened, then it's very important for the child also. So long persistent anxiety, as I've said, lack of sleep, getting totally withdrawn, not eating, not taking care, not talking very positively about the pregnancy. Yes.
Does talking about the anxieties actually help?
Of course.
How does it help, ma'am?
Talking about it takes when you are talking about a problem, first of all, you are letting the fear out. The problem with fear is that we run away from fear. Anxiety is an offshoot of fear, right? When we run away from something which is scaring us, okay, it becomes even stronger because a lot of unknown factor is there. We are scared because of the uncertainty. Anxiety is because of the uncertainty. That's the bottom line. So when they discuss, what happens is they also can see that some of their fear are totally illogical.
Okay.
If they discuss it with a professional, if not with the professional initially, with some elders or with the husband, that I'm scared, okay, about this and that, what's going to happen, is my baby all right, is the baby moving, okay. Those are the very common thing. I'm sure when they talk and they hear about it, much of the energy which is bottled up, it goes out. That's a relief, and at the same time they get some truth about it.
Okay.
Not the false ideas. Yeah.
Ma'am, what are the kind of mental health services that are available for women in these three phases? How do we help?
When the couple they are planning, they usually can go to a obstetrician or the gynecologist first to discuss who's going to be the doctor. And they can first, if there is anxiety and all, most of the time the medical doctors have they can refer to a psychologist or a psychiatrist, counselor, usually a counselor. Many obstetricians, they have their counselors on board to talk about, discuss and get a good idea. During pregnancy, again, if it is severe, they can go to a psychiatrist. I think even with a very big severity of depression or anxiety, the medical doctors, I mean the obstetricians, they refer to a psychiatrist. So it depends upon which is which accessible to you, but there are plenty of counselors and in a city like Bangalore, Mumbai, Delhi, they have a lot of counselors on board with the obstetrician, or they can contact clinics like us, who take care of especially women. We cater to especially women, so they can contact anyone.
Okay.
Motherhood, then, you know, the birthing places, they have their counselors on board
Okay.
for typically for the, you know, pregnant women.
Ma'am, any self-care tips for
Oh,
women in these three phases? Just a
plenty.
couple of them.
First of all, you know, to be in a very, very peaceful, you know, environment, uh, having beautiful, you know, um, music to start with in the morning, very, you know, cool, what would I say, music, aroma, to create an environment, you know, very pleasant, very happy, uh, to walk, take care of your, you know, body as much as you can. Physical things are, you know, the doctors, they tell, you know, how to take care. Mental would be like talk.
Mhm.
Whenever you are, you know, having any doubt or any reason, communicate. The communication is the main thing, with, of course, with people whom you trust, not to people who will, you know, create more confusion. You have to be careful about it. Meditation is very good. Light yoga is very good, to be centered, and to, you know, put the focus, any activity, any mental, emotional, you know, outing activity, whatever, you know, conversation, so that the mind takes it as a very enjoyable and wonderful experience.
Okay. Thank you so much, ma'am, for joining
Welcome.
us today. You've given us a very wonderful, informative, and comprehensive overview of these three phases.
Thank you.
What are the
My
kinds of
pleasure.
stressors that women who are even planning pregnancy up to the phase of post-delivery can go through? The importance of the environment, the partner, the importance of open communication, all of which can affect and influence a woman right from her readiness towards pregnancy to even adjustment post delivery. So thank you to all our viewers for watching this. Please follow the Reach Clinic channel for more videos, and you can reach out to us on the numbers provided. Thank you so much. Thank you, ma'am.
Thank you, Rachel. Thank you, Rachel.